Hi, my name is Beth, and I am a doctor of physical therapy and creator of the SCORE system, which I am introducing today. SCORE stands for Spine Core Optimal Recovery Exercise, and the key word in the system is optimal. So you might say, well, I've had core strengthening before. It didn't work like it was supposed to. I'm still in pain. But that's where the word optimal comes in. There are optimal exercises to be performed. And because you haven't had success in the past doesn't mean that you cannot have success. This system has helped many clients who have come in, never before had pain relief, years and years, and I mean some clients 40 years of pain. And the system works for them. It's just so exciting to be able to watch someone who has not had any help from any other treatments before and to fit so well into the system, which many people do. The medical definition of the core is the diaphragm, the pelvic floor, and 360 degrees around that area. So there are many muscles to rebuild in that area. And what this system does is capture the lumbar paraspinal muscle and the lower thoracic paraspinals, which are the long muscles on either side of your spine. So we sit a lot as a society now, and our pelvis just gets dragged down, and when that pelvis drags down, the muscles above it, it stretches them and weakens them. And so it is the best muscle. It's the best place to start because the flare-ups are very low. I used to start at the transverse abdominis muscle first on a first visit, and too many flare-ups occurred. And so we've discovered over time that starting with the paraspinals, it is rare for someone to flare up with this exercise. So you're starting at 0 degrees or arms by your side, and you're moving your arms to 90 degrees or straight out in front of you. You will do 2 sets of 10, 3 times a day in the position you see me now. So you will be against the back of a straight chair. You will not sit on the edge of the chair. You will not stand up, and you will not go grab some dumbbells and add dumbbells. The weight of your arms is all you need. If you're holding a 5-pound plate weight out in front of you, that is 50 pounds of pressure on your back. So no one who's been hurting for a really long time and has chronic pain and high levels of chronic pain needs to be holding dumbbells. So the weight of your arms, it's activating the back muscles, and the chair is putting your back in the posture that it should be in. When you're on the edge of the chair, no matter how tall you think you're sitting, you're not going to achieve the best alignment for your spine. All right, so 2 sets of 10, 3 times a day for this exercise. When our clients with lumbar radiculopathy come in, pain all the way down to the foot, the knee, the hip, whichever, it doesn't matter. This is what they're getting. This is their first exercise. Even if it's down both legs, this is their first exercise. If you have shoulder pain, you're going to be a little bit more different. You cannot do this exercise. There's yet another optimal exercise for you, which is really a modification. If you have right shoulder pain and you do both arms at the same time anyway, I can guarantee you will make your shoulder pain worse. So if you have right shoulder pain, then only raise the left arm. I routinely put my hand on the client's muscles and palpate and see if they are performing correctly. And you will still get a lumbar paraspinal contraction on both sides of your back when you're doing just the single arm. Do not exercise in pain. Do not provoke your pain. You will only keep doing an exercise that is provoking your pain. You will not be exercising and building strength. If you, unfortunately, have pain in both legs and pain in both arms, which happens, you cannot do this exercise at all. There is an exercise for you. It's just not this one. And we will possibly go over that one at a later date. It is very tricky to have someone who has pain in all extremities, and it's much more difficult to treat, but it's very, very doable, and we do it all the time. But that's really probably something that doesn't necessarily need to be done that is not in person. All right, so 2 sets of 10, 3 times a day. You might feel like you're doing nothing. Clients will tell us that, and after a couple of weeks or so of more exercises that we give them, they really are astonished that simple movements are starting to take away their pain. Remember, I'm not diagnosing anyone, and we are introducing the system of optimal recovery. This can totally take away people's pain sometimes when they've only been hurting 2 days. And if you've one of those who've been hurting 20, 30, or 40 years, it's going to take a little bit more of the system before you start to feel some pain relief. Don't exercise in pain. You'll just be exercising your pain. And again, we're not diagnosing, we're not treating you, and just trying to educate you to help you recover because it's possible. Thanks so much. Have a good day.